Okay, here we go. So again, thank you for coming out this afternoon. As I mentioned, we're going to have a couple portions to this webinar. Before Richard gets on, I'm going to address just a few things that, a few ideas, a few lead generation techniques that we see organizations, agents, agencies using across the country, and none of these are wrong. That's the thing with lead generation, and I'm sure Richard would back me up on this, is we see all types of lead generation. Some work just because of maybe the area you're working in, maybe it's your demographics, maybe it's the product you're using, maybe it's your own strengths, but pretty much all of these work. And what I say as we go through these is don't look at any one of those and say, well, this is the only way, or if you see one and you try it and it doesn't work, then you move to the next one, it doesn't work, and then you move to the next one. With any one of these systems, you do have to persist. You do have to put the time, energy, and the resources into making these work. Some of these can be very, very successful techniques to lead generation, but when you meet with the agents and the agencies that are using these, you'll find out that they did not just happen overnight. Some of these have been a work in progress for many, many years, and now they've found the system that works. Now they've got the momentum in their direction. So, again, don't try the shotgun approach. Don't try one. If it doesn't work, you move to the next, then move to the next. We really want to share with you these ideas, but in a way that you can pick a system, pick something that might work for your clientele, and stick with it. And, of course, at Insurance Advisors Direct, not only do we have the carriers and the training, but we certainly have many of the marketing techniques and tools that you would need to make any one of these work. But let's spend a few minutes on each of these. So, of course, one of the easiest ways to either break into a new product line, introduce a new carrier, new product, is to work with your existing clients. Now, depending on where your clients are coming from, maybe you're coming from some other industry, maybe they're primarily rooted in the group market, maybe they're property and casualty clients, group, individual. Again, take a look at your client base, and if you're looking at introducing a new product, maybe you're looking at getting into long-term care, maybe you're looking at getting more active into the Medicare marketplace, your existing clients are a great place to start. Now, hopefully you're doing some regular communication with those clients. Maybe you're doing some letters on a frequent basis. Maybe you're doing some sort of newsletter. Maybe you put on live events that you bring in your clients and maybe speak to them on a particular topic or bring in some guest speakers. Those are all very successful ways of staying in front of your clients. Maybe it's pre-approach letters or personal phone calls. They all work. Of course, if you have a client base to speak of, we encourage you to be doing these things regardless. Maybe it's just to maintain your current book of business with your current product lines. But all of these are important, but they can certainly help get you in front of your clients, maybe generate some referrals as well. But you have to be contacting and staying in front of your clients and educating them about the potential for needs in certain areas. Because think about it, your clients need more than just one product, okay? They're buying various products for different needs. Maybe it's for different needs that their family has. Maybe it's for different needs that they have as they age. And if you're staying on top of those and you're working with them on a regular basis, you're going to know about those needs and have a chance to address those with the right product and the right carrier. If you need marketing pieces, things of that nature, at Insurance Advisors Direct, of course, we have a marketing team that can help create those for you and help you to send those out to your clients to stay in front of them. And I know Richard's team can do the exact same thing for you. So between the two of us, of course, we have those resources that you can actively and proactively stay in front of your clients. We know if you're in the Medicare arena, a lot of our agents are active in Medicare, getting into Medicare. Some like to keep it simple, fairly affordable, and work off of the turning 65 list, maybe by setting appointments or sending out letters. This can work. In some areas, some of these lists may become a little bit thin. They may become a little bit saturated because the turning 65 market has become a very, very active place to be. There are a lot of agents addressing these people, but again, it's a low-cost way that maybe somebody just getting into the business, somebody who's just looking at tapping into Medicare and wants to do it as affordably as possible. You might look at some turning 65 lists, which of course can be secured through Insurance Advisors Direct and Target Leads. Now we see seminars. A lot of agents have decided that going into the seminars and maybe establishing themselves as a local expert in a particular area is a successful way to do it, and it can be. But again, it doesn't happen overnight. You have to have the right marketing to get people into the room. You have to have the right presentation and materials and products that would be of need or of interest to these people. And, depending on which age group you're targeting, the area that you're working in, where do you do these? Can you find a facility that's low cost, maybe a library? The one thing I will stress is that when we see agents doing seminars, it does depend on the market and the product that you're representing. We know a lot of agents in the annuity market who do these very high-cost seminars where they're providing meals and so forth, and those can work, and there may be nothing wrong with those, but those are also a very high-cost way to go about doing this. There are other low-cost methods that you can use. And if you're interested and need more assistance, of course, we can bring that to you. We even have the presentations built out, so if you're looking to bring your clients or bring people, prospects, suspects into a room, we even have the presentation material that you can hand out and give to those individuals to educate them further on those particular topics. But seminars do take time, and you do have to persist to start to see those numbers coming in the door that you would like. Now, one of the other ways to grow both a referral network and maybe even to drive more people to seminars is partnering with other professionals. If you look at this list here, CPAs, investment advisors, P&C agents, credit unions, these are all sources that may be looking to partner with an agent. I know with some of our agents who are in the Medicare arena, they have partnered up with financial planners. Financial planners are looking to bring in more money into their firm, and in many cases, to get people interested in their products and services, they will talk about Medicare, Social Security-related items, and in most cases, those organizations do not have anyone who is Medicare literate or trained that can effectively come in. And a lot of these places will do seminars and will invite agents who are experts in the area to come in and speak to their clients or prospects about these topics. And in most cases, these organizations, as long as there's a firm agreement in place as to what you can do and can't do, in many cases, if it's the Medicare business, they say, hey, that's yours, and we'll take care of the financial and the investment side of things. And just be mindful of that. These are our clients. So if you have never reached out to some of these professionals, I would recommend this, again, as a low-cost alternative. It just takes a few moments and a little bit of courage to walk in and introduce yourself, introduce your services and your expertise. Maybe you have some friends in the business, or maybe your friends have some friends that are in the business. That's another way to get in front of these people and just ask them a couple simple questions, and there might be a great partnership and referral opportunity in this area. Social media. Now, this is a tough one between, the web-generated leads. Of course, they're out there. There are certain sources. Some are okay. Some aren't so good. But social media, website, SEO-type generated leads are out there, and they can work. But at the end of the day, a lot of it is about, okay, what is your return on investment? What is your cost per lead? Or at the end, your acquisition cost to gain a new client. In some cases, those sources might start off low cost, but that cost can grow substantially as it takes many more leads to get in front of actual buyers. Social media, the click-throughs and so forth, it may be good to have your brand out there, especially if you've been building your brand for a number of years. People like to see you in their social media settings. They like to see you on the web. But it might be, again, in some cases, a costly way to generate leads. And we do see some that have been doing it for many, many years and have kind of perfected that strategy. They may have systems that work well and still remain low cost, but again, it's something that takes time to get familiar with. Now, websites, we talk about that as a lead generation tool. Beyond just a lead generation tool, I would recommend everyone who's in an industry, who's a professional, have a website. In many cases, people today are more web savvy. They're used to doing business with people in more of an electronic or virtual format. And in many cases, even if they want to meet with you face-to-face, the website's a great way for them to research you, feel more comfortable with you. And if you don't have a website, that might deter them. I know I've talked to people who say, hey, if I look somebody up and they don't have a website, I won't do business with them. I want to know who I'm dealing with. I want to make sure that they're professional enough that they can do the bare minimum of setting up a low-cost to maybe free website that's maybe just a simple about me and my business page. So I would encourage you to do that. We do have some sources that do appointment setting. We have some agencies that will have that done internally. We have also external sources, organizations that you can hire that will do either like live transfer calls or they'll do live appointment calls and set up your calendar for you. Again, these might work for you in your business, but these can also be very high-cost alternatives. But for some, they work well. And for some, that's the way they do business. And that's something that might work better for you if, let's say, you're an agent that doesn't leave the home. Maybe you like to work with your clients over the phone, through the Internet, e-applications, and so forth. Maybe that system would work better for you, and those lead costs and the higher lead cost isn't a problem. But for many of you who like to get in front of people face-to-face, that might be a little bit more difficult as far as the cost is concerned. But there are sources for those, and, of course, if you have additional questions, we would love to help talk to you further about that and educate you. And then we come down to what we still find is one of the number one choices amongst advisors across the country, and that is direct mail. Why is that the case? Well, direct mail has remained consistent. It has remained affordable. It has acquisition costs, all those costs that we talked about that we all have to be concerned about from a marketing standpoint. It is one of the lowest cost ways to get in front of people and to make a sale. And again, because of the world that we live in and because of the technology and the emails, people are so inundated by other forms of advertising that we still see direct mail being a great way to get your name, your brand, and your products in front of people. And because of that, we wanted to bring in one of the industry experts, which is Richard Bufkin from Target Leads, and wanted him to spend some time to talk to you about why direct mail works so well, what other avenues you can use with direct mail, and when it comes to Target Leads specifically, how Target Leads can help you to be more successful in your industry and successfully get you in front of more people in a very low-cost way. So those are some of the different lead sources that we find advisors tapping into, successfully using across the country. If you have any questions, please, again, either type it into that box or there is our contact information throughout. You can contact us direct, and we'd be happy to have additional conversation with you about these. But to move into our next section, I wanted to have Richard take it from here and talk to you more about this number one choice of advisors, and that is the direct mail lead sources.
Thank you very much, Jason. We're going to dive right in. And again, Jason said any questions that you guys have, use the question box in the bottom left, and we will get to all of those. So Target Leads, we've been in business for 31 years and have been primarily in the senior insurance industry for 31 years. So we've got a bit of a track record, and we're going to talk about some of the highlights of what's really working really well today and some ways to make it work better for you, and then a couple other ideas as well. So turning 65, what I hear a lot is, oh, there's so many people in the market, it's just inundated. It is, but that's not a problem because using direct mail, it is just absolutely a numbers game. So with turning 65, we recommend getting out 4 to 8 months. It gets in front of a lot of the other mail, and it's just an absolute numbers game. Something that a lot of and we'll get more into each one of these. The over 65 market is a very, very lucrative place to market, especially when you've got a product that is very well priced for niches. So when you get to the over 65 market, these people have been through the process of Medicare. They understand how it works. And if you can provide better service and a better price, people are very, very open to conversations. The dual, the SNP programs, the Medis, these are averaging 4% response rate across the country. It's a very, very hot market. And the last one is combination leads. All of our leads, any of the formats that we have, they're all variable. So we can change them, and the combination leads allow you to discuss a multitude of products and gives the consumer the opportunity to check off what they're most interested in. So turning 65s, we're recommending that you market at least 4 to 6 months out. If you try to mail 2 to 3 months, your response rate will drop dramatically. We have some agents that are mailing 8 to 12 months out and establishing relationships so that when it does come time, they've already got that consumer to become an advocate for that consumer. So when they're getting inundated with more and more mail and other solicitations, they already know that they're going to call Jason or Jason's going to call them a week before their birthday. Here you can see the average. This number is based upon the last 6 months. So turning 65 is averaging right around almost 3% response rate. So again, the over 65s, they're not as heavily marketed. They're getting a lot less mail. Your mail gets through a lot better. Again, they know the process. And we've got a good example with a company that's in Kentucky. It's kind of random. And they have a product that works really well for women that are 70 to 74 years old. So we market specifically to women in Kentucky that are 70 to 74 years old, and their response rate is consistently over 5%. So do not forget the over 65 market. It's something that gets really overlooked with, the turning 65s. There's a whole wealth of people that may not be happy and are always looking for a switch. Dual eligibles, over 4% nationally. Most of our mail these days goes out on a format that looks similar to what you can see here, and these actually go out first class. So our leads are coming back extremely quickly. One of the allure of phone setting or web leads is that they're instantaneous. Well, with direct mail, it's very targeted, and it does take 7 to 12, maybe 14 days. And one of the things that Jason mentioned earlier when he was talking about jumping from source to source to source, one of the things that's really important about direct mail is that it's really not a one-off campaign. It's something that when you find the right methodology for yourself, it's something that you need to be doing on a consistent basis. So, for example, I wouldn't want an individual producer to mail 10,000 pieces and get back 400 leads. No. You're better off mailing 1,000 pieces every 2 or 3 weeks forever so that you're getting, 3 to 5 leads every day. Right, so we help you calendar your life so that you've got a very consistent flow of leads. So the question here, does Target Leads do any combination mailers for Medicare and LTC or LTC by itself? Yes, we do. we'll get to combinations in 1 second, which is right here. So you offer the consumer checkboxes for your areas of interest. This also, if you've ever worked direct mail, you may have come upon the objection of, I didn't send that in, or I don't remember that. Well, when they're checking off stuff, it seems to resonate more. And then you've got the opportunity that you're already talking about a multitude of policies and cross-selling opportunities. So to your question, most often on a combination piece, the very first one is Medicare. And then you often get final expense insurance, or sometimes annuities get put in here. This is often how annuities get marketed. And then long-term care coverage. So long-term care, we didn't plan on spending a lot of time on this, but we are the agency that works with the 3 and 4 Need More campaign. We do a lot of long-term care mailings. I've got contracts with 2 state entities. One's the California Partnership for Long-Term Care, which ironically we've had for a decade. So I take that as a huge victory that we've been able to work with the state of California for 10 years. I live in California, and it's a difficult place to do business. And the state of Louisiana. We could customize. Yes, absolutely right, Jason. What's not working? Overqualifying your leads. So I gave you one example of where we got really highly qualified, and that was because there was a specific product to back it up. A lot of agents that are new to direct mail, they want to get so unbelievably specific that you take out all of the numbers game and you get down to really, really minute number of responses, and all of a sudden the numbers are not in your favor. Often when dealing with Medicare or final expense, putting a cap on how high out you mail can help increase response rates. But then for other product lines like long-term care, mailing into that higher income is a good thing. Now, it's kind of a double-edged sword. We're going to talk about my software system in a little bit, but my software system allows us to run a lot of analysis on responses and who's responding and where they are in the income spectrum. And so I find that it's a double-edged sword. So if you're mailing 1,000 pieces, maybe only 25 out of those 1,000 pieces will be over, let's say, $250,000 in estimated annual income. So, if you just figure 50 cents, you spent $12.50 to mail people that most likely are not going to respond. So this is a very easy way to save some money and to tighten up your target. The other side of that coin is that when you get someone that responds that are over $250,000 looking at Medicare supplement policies, well, you know that they've got a lot of resources, and this may be a very good opportunity to talk about long-term care and or annuities or other products. So the job of the lead is not to make the sale. The job of the lead is to make the introduction. It's the job of the lead to entice someone to say, you know what, I do have a concern in this area, and I am interested. And so then you don't want to clutter it up. So white space has a lot of value on paper. And here's just an example of some campaigns that we ran and looking at the higher response rates. So you can see here that over the people that were mailed in this group, 846 were over $500,000 in income, all right? And that yielded a 1.5% response rate. So it's not bad, all right? Now what's important to note about these numbers is that these numbers are all based upon an over 65 mailing. So just so you can see very clearly, people over 65 are very interested in what you have to discuss. What else can we offer? Telemarketing lists, as Jason said. If you're looking for call lists or walk and talk lists, we provide those. One thing to know is that with the do not call list, you've really only got approximately 15% of the population that's going to appear on those lists. So again, long-term care, annuity, final expense, dental, cancer, other things, we've got pieces for that. Print and mail your own custom postcards. So I've got a complete art department. So if you've got an interest in having your face and your logo on a mail piece, we've got a lot of resources to help you out in that arena. Additionally, I alluded to my software system as TL Lead Manager. We're going to spend a couple minutes on that right now. And then My Senior Venture, which are websites for you guys. And the last thing is a lead and revenue source called Hearing Benefits Mutual. So 15 years ago, before I was the president of Target Leads, I developed TL Lead Manager, which is our contact management lead management system that's designed specifically and solely for the life and health insurance market, more specifically for the senior life and health insurance market. So this system is built exactly for you guys to be much more organized with your clients and your prospects. When you're doing business with us, if you're doing business with us on a regular basis, we're going to give you this program. Jason's organization has been using this for got to be close to 10 years. I'm not going to go into all the ins and outs of how the system works, but there's a couple things that I think are really important here. One is that at 4% response, you're talking about $10 leads, $11 leads. That's how much they're costing to generate. But you've got to treat every one of them like a $1,000 bill. So if you don't have a CRM, a client relationship management software, you really need to look at mine. If you have one that you don't love, you need to look at mine. If you're still working off of paper or a spreadsheet, please stop. Please stop. Like Jason said in his intro, staying in touch with your clients on a regular basis, whether it be a phone call, a card, a letter, and at worst case, an email. If you're not in front of these people at least once, twice a year, someone else is going to be. So software systems like this help it make it very, very easy. And the other thing about databases and taking notes on people is that when something happens, like the proposed Blue Cross Blue Shield rate increase on the legacy plans that are coming up, if you've talked to a prospect and they said, oh, no, I've got this Blue Cross plan. Well, now you know this is happening, and it makes it very easy to search for everyone that you know has a Blue Cross plan and go to them. Hey, we spoke 6 months ago. It looks like this is going to happen. I want to let you know what your options are. It's a great way to create leads from leads. So, again, my job is to make an introduction, to get someone to raise their hand. Using software like this and some of the other tools help you create leads from your leads, so that now you're in a multiplication exercise instead of an addition or subtraction exercise. Your time is precious. Calling people back when you say that you will. I'll call you back next Thursday at 1 o'clock. Please call them back at 1 o'clock. So having a system that's going to alert you, hey, I've got these calls to make, and when they are, it's vital in today's world. And with caller ID, it makes it really helpful to put into place that you left a message or that they didn't answer on these dates and times so that you can be much more organized with your time. So if you call someone 3 times in the morning and they don't answer, try them in the afternoon. They're not home. And if you're working from paper, most of the things that I've seen on paper, you're just putting down dates and you're not as organized as you can be, and you waste a lot of time. So the duplicate list, when you do direct mail with us, for $15 more, you can get the entire duplicate list. You can get it with phone numbers or without, et cetera. But most of our clients that utilize on a regular basis say that they make as much money from the non-responders as they do from the responders. So with an Excel spreadsheet or using my software, it's really easy that when you get a lead and they're at 123 Main Street Makes it very easy to see that, hey, look, we also mailed 125 Main Street. That's their next door neighbor or 2 houses down. So now you're armed with the name of the neighbor, right? So it makes it very easy to ask that lead for an introduction. Or if you're not comfortable with that, just walking next door with a copy of the lead piece. Say, sir, I was in the neighborhood. I was meeting with your neighbor, and I know that we also sent this to you, and you haven't replied yet. I'm curious if I can ask you a couple questions. So don't overlook the power of the duplicate list or the non-responder list. Direct mail and your activity, the number of phone calls that you make. So if you take the math all the way down, how many pieces of mail you send, to how many responders, to how many phone calls you make, to how many appointments are generated, then to how many sales come from the appointments. All of that math is real important in helping you decide which lead type is best for you. Is it you getting the most bang for your buck with referrals from P&C agents or direct mail or web leads or whatever it is? If you're not tracking these numbers and figuring out that math that ultimately results in your cost per sale, you're wasting time and money. Our system helps you do it. You can do it with a spreadsheet. You can do it with a piece of paper. But I really, really encourage you guys to look at lead generation as a math equation. We covered this. It's important to make sure that you're in front of your people on a regular basis. My system can automatically send out birthday and anniversary cards for you and help you be aware of the changing policy landscapes in your backyard. So again, to the Blue Cross example, this is going to happen for a lot of you guys in Michigan, for those on the call that are in Michigan. It's a great example of seeing something that's coming down the road and being able to take action on it, and having your clients and prospects in a database makes it all the easier. So just on that point real quick, for those of you in Michigan, Jason and I have already put together a couple pieces in anticipation of this rate increase on the legacy Blue Cross plans. So if that's something that you're interested in, just be in touch and we'll get you that information. All right, now we're going to switch gears. Agent websites. Still blows my mind how many agents don't have a website or don't have a good website. So we have this program called myseniorventure.com, and they're gorgeous, and they're CMS compliant, they're lead generators, and they're also filled with videos. Medicare Supplement, Medicare Advantage, Social Security, long-term care for whomever's asking about long-term care. Caregiving, there's a whole section on discounts, and they are very, very good looking. So we're not going to take a lot of time to go through all the ins and outs of the website, but you can get a look at what it basically looks like right here. Yes, the website is 100% mobile friendly. Someone just asked that question. These are mildly customizable, so we've got a whole contact us and about us page, and for clients, we upload videos that they've already made, and we spend time. If you don't have a logo, we can create a logo for you, and these things are gorgeous. So here are these bullet points. You're going to pre-educate your clients. As Jason already alluded to, the legitimization of credibility is essential today. You're going to make more money, and you're going to build instant trust. So we call these universities because on each of those topics, Medicare, Social Security, long-term care, and caregiving, there's a full educational university that's behind it. And fortunately, we have a very good relationship with CMS, and this is all compliant. What we have seen over and over again is that you set an appointment with a prospect, and you say, look, I look forward to meeting you and your husband next Thursday at 1 o'clock. I'm going to bring some cookies that my wife makes. But before I come, I need to send you guys my website because I highly recommend that you go watch the videos about the difference between Medicare Supplement and Medicare Advantage plans. And now appointments that used to take 90 minutes are taking 40 minutes. Agents walk in and they're like, we've decided we want the HDF plan. Like, okay, I think you're right. Let's talk about this for a minute. Let's see here. So after this call, I'm going to send you guys all a document that's got some links to example sites and places that you guys can look at all of this stuff. And we're here to answer all the questions and help you get set up, etc. One other part about this is that if you're working with association groups, P&C agencies, companies, etc., for the price of one website, you actually get two. So HR divisions love this program because it takes all the headache away from them as their clients, as their employees turn 65. Like, oh, just go to this website and you'll learn about it, and the phone number to call is right on there. And with your P&C relationships, as an example, you do the same thing. You've got a myseniorventure.com/P&C agency. So now the P&C agency can just forward all of their clients that are aging in to this website, and it directs them all to you. About this, yeah, and your name and phone number and stuff is all over the website. Back to you guys. Most of the time, consumers are calling from the website, but there is the ability for them to fill out a submit form on the website, and if you're using our TLE Manager, it would go right into your CRM. Otherwise, you get an email that says you've got a new lead. Okay, let's see. Okay, so the last topic that we're going to go through is what's called Hearing Benefits Mutual. And this is a discount hearing program. It's unlike anything else out there on the market. We helped design it. We were brought in as the marketing component to help finalize this and bring it to market and to agents and agencies like yourselves. This program is providing 30 to 60% discounts on hearing aids. 5,500 locations around the country. And you make a $50 commission on it. $50 commission is not a life changer, but it's very good. And going back from generating leads from leads, this is an incredible way to generate referrals. And during the conversation of what Medicare covers and does not cover, it's very easy to say, and just so you know, Medicare does not cover hearing health care. But as a client of mine, you've been automatically enrolled in Hearing Benefits Mutual. You just call this 800 number, provide them this code, and they will set an appointment. It's all free. This is very much a concierge-style experience. You've got clients that have a hearing, dental, vision policy. A lot of them have a year waiting list before they can utilize the hearing benefit, and let's say that benefit is $1,500. Now, as those policies turn into their 366th day, this is a great reason to call your clients. Hey, you've got this policy. We want to let you know that now the hearing benefit has been enacted. So here's how the math works. So on a $6,000 pair of hearing aids, all right, at 60%, let's just say it's 50% to make the math clean, it's $3,000 that the consumer would be out of pocket. And now with the indemnity portion of the hearing policy, they're going to be reimbursed $1,500. So now your client has a $6,000 pair of hearing aids that communicates with their iPhone for $1,500. With this program, it's free to sign up. You just go through our sign-up wizard. There's a W-9 in there. It's very easy. We've got you get a basic website that comes with this that's all hearing centric and it's got your name on it and your picture on it, et cetera. But then we've got all of the collateral material that you would need, whether it be posters or stand-up displays for doctors' offices, PDFs, the whole gamut. It's all there. Okay, so that is the bulk of what I want to talk about. Again, after this, we're going to send you all an email that kind of summarizes all these points, and we'll provide links for websites for you guys to go and look at some more of this information and see if you have any interest. Give us a call. We'll walk you through the whole thing. We as a company really pride ourselves in customer service, so that's why on all our material you'll see our phone numbers everywhere, because we really want you to call us. I'm going to go through some of these questions right now. Are these websites only for senior products, or do you have design websites for general agents under 65? If you want to, Victor, if you want to talk about doing some redesign for other products, just give us a call, and we'll walk through that. That's a little bit outside the scope of the My Senior venture, but we do that as well. What lead ideas do you have specifically designed to get out in front of the legacy price increase? Again, happy to share those pieces with you. Let me see here real quickly. I can read you some of the language. I can't show it to you right now. But it says expected increase in premiums for Michigan Medicare plans. That's what it says on the outside. A major Medicare plan provider in Michigan is expected to increase their Medicare Supplement and Medicare Advantage plans starting on September 1, 2016. You may or may not have been notified about this. It's expected to be about a 50% increase per enrollee. And then there's a second version, which is basically the same thing. Premiums for Michigan Medicare plans expected to increase. That's the general gist of the language that we have around that. Now is your chance for more questions.
Also, I wanted to add a couple things, Richard, if you don't mind.
Please.
And of course, maybe this could generate a few more questions. But speaking, working with Target for many, many years, like we have, working with many other vendors in different areas, or lead generation companies. Obviously, Target has one of the most complete systems we've ever seen. In fact, some of our comments pointed to the fact that your lead management tool is one of the best ones out there. So, one of the other reasons why we encourage you to partner with a quality company that provides great lead options and tools to support those. But speaking on behalf of someone who's actually used the Target leads myself, in the field as an agent, it's a great source, again, a very affordable source to get in front of people. And the nice thing about it is Target is willing to work with you to develop leads that might suit your particular needs as far as a particular product line, or maybe it's something specific you'd like to send out. We've in the past done combo leads where an agent wanted to do seminars, but they know everyone may not be interested in attending a seminar, so we did kind of a split piece that offered the ability to have, hey, if you're not interested, check this box and we'll send you some information and reach out, in the future. One thing I would always recommend, and Richard mentioned this earlier, is adding some check boxes can also increase the activity level. In fact, especially with Medicare supplements, if you look at complementary products, one of the most popular things today is selling dental, vision, hearing products with Medicare supplements. Well, why not add that checkbox to your Medicare lead piece? It's a pretty standard practice, I think, down there with Target, and we have seen an increase in response rates by doing that. And of course, not only does it give people what they're looking for, let them know that you offer those programs, but it's a great sales opportunity and a great another area to generate some additional commissions to help, again, put more marketing dollars back in your pocket to stay in front of more people. And Target does a great job at customizing those lead pieces to make sure that they're going to continue to be effective, yet, again, still offer other check boxes or options that you can use to introduce other products. So just a couple comments there of things we've done with lead pieces that have worked really well.
Thank you. I want to talk about, I forgot to touch on seminars because you made a great point. I have a friend of mine who lives around the corner. We coach youth lacrosse together, and he's a financial advisor, and they're in the senior space, and they've been doing seminars forever. That's their primary way of doing it, and they do it at a very nice steakhouse, and they were paying about $8,000 per seminar. And so I said, man, I think you're overkilling this. So I think you should try it my way. And he's like, sure, no problem. So he went to the local community college and secured a room for 3 nights in a row. And we mailed out a much more simplistic postcard than this really elaborate wedding invitation style. So he saved about $3,000 on the mail, and he got the room for free. And it was more successful than serving steak and lobster and all of this nonsense. So seminars you can use. I mean, I have a lot of clients that use like the local library and places that they're paying $100 for the room or $0, and they're only providing coffee, tea, water, and cookies. They just go to Costco and buy a rack of cookies, and it weeds out a lot of people that are only there to eat. And brings in the people that are really serious about being there. So that's one little note that I'd made about seminars. And this happened like 2 months ago. And I called him. I said, so how'd it go? He goes, I can't believe it. We got 20% more attendees than we ever have. So one question was about the price. Yeah, it was about the price of the CRM. Oh, here you go. When you're buying leads from us on a regular basis and you're a client of ours, it's free. If you decide 6 months later or 2 weeks later that, hey, I don't want your leads, but I want your system, no problem. It's $40 a month. And the other thing is that if you're using my system and you decide, hey, I'm going to go with some other system, we will export all of your leads to you in a spreadsheet, in a matter of minutes. So that's all your data. It's all encrypted. It's all really highly sensitive to us protecting your data. As we say, the only thing that we do with your data is secure it and help you get the most out of it.
Mm-hmm. Excellent. Any other questions out there related to the leads, response rates?
Here we go. Oh, this is a great question. Thank you, Victor. Are leads exclusive? 100%. 100% exclusive. Every direct mail piece that we send out has a code on it. That's your code. We get the leads. We distribute those leads to you. Either we send them to you, or we scan and email them to you, or they go into the CRM system. But that lead is never resold. It's never taken away from you. That is your lead. The other thing that's a little bit different from us than other companies is that, we work off what we call a 90-day file, which means that we have not mailed nor will we remail any household for 90 days. A lot of our competitors work off typically a 60-day file. We find that 90 days is better for you guys as agents. It's also better for response rates. So that lead is 100% exclusive. It goes to you, and then we're done with it.
Yeah, that's a great point, Richard, and a great question because, working with many other lead programs and carriers across the, country for many years, we have seen some pretty interesting ways that I would have never thought of that some of these lead vendors have gotten creative to obviously minimize their costs, maximize their profit, but yet reduce the effectiveness or at least the quality of the lead. And that's one thing we've always appreciated about Target is these leads are exclusive, these leads are real, and never resold or made up. And it's been that's something. Though you may not think about it, it does happen out there. If you hear of a lead source that's going to give you a 1,000-piece lead drop for $250, unless somebody's co-oping that, you're probably not getting exclusive leads, I promise you.
Right. One of the last questions was about the cost. So a couple costs. So the cost for being with Insurance Advisors Direct is a very, very substantial discount. The price is $455 per 1,000 pieces mailed. For turning 65, there's usually an extra $15 for additional postage. because the number of people turning 65 in an area is usually pretty spread out, the postage gets astronomical. So there's usually just a $15 additional fee in there. The difference between me and Kramer. Well, Kramer just retired. Congratulations, Alan. Kramer has been much more focused in the long run on sending out pieces that provide booklets, fulfillment mail pieces. We do that if you want it, but we have always found that the conversion ratio is better on leads that do not provide booklets than those that do. And we've always been in the business of go meet the person rather than send them a booklet and give them another reason to say no thank you. Other than that, Kramer has run a very good business for a long time. I know Alan well. And in a lot of ways, we're similar, and in a lot of ways, we're different. And the best way for you to figure out how we're different is to try an order or two with us, and then tell us about the difference in experience. So there's my kind words about the difference of my competitor.
Yeah, that's always a tough one, but perfectly said. Well, looks like we're coming to the end of our time. Anything else you want to share, Richard, before we let everyone go?
No, I think as you've seen today with Jason's introduction and what I went through, there are a lot of ways to reach your potential client. And you've got to stick with these proven techniques for more than just one try. You can't just shotgun and jump and jump and jump. You've got to commit to something for at least a period of time. As long as it's not some brand new shiny object, you should have success with any of these methods that we've gone over today.
Great. That I completely agree with that. And again, if we'll hang on for another second if you do have a last-minute question. But as you can see, there's some contact information both for Target as well as at Insurance Advisors Direct, and we'd love you to reach out to us, ask us these questions. You know, we can talk further about details and how these may apply to you and your business, how we can help you in your marketing efforts. We can get you some samples. We can get you some rates. And as Richard mentioned, he's going to be sending you each some additional information, and we will be following up with each of you very shortly as well. So, again, thank you guys for coming out this afternoon. Appreciate you spending time with us, and hopefully we were able to give you a few new ideas that you can walk away with to benefit your sales practice, benefit your lead generation. So, again, if you have any additional questions, please feel free to give us a call. And at this point, we'll end our webinar and let everyone get to the rest of their day. So please have a great day. Thanks, Richard.
Thank you all very much. Thank you.